When I was born, I was diagnosed with a congenital heart defect called transposition of the great arteries. This meant that as a baby, I had to have an open heart operation to correct this, and ever since then, I've continued to have more operations and will do in the future too.
So I'm an adult nurse and a children's nurse by background, and my children's nursing, I worked in 3 different centres. I worked in Oxford, in children's intensive care, and then Great Ormond Street in the cardiac intensive care unit, and then moved to Birmingham Children's Hospital.
All of my operations as a child were at Birmingham Children's Hospital, where I was cared for by a cardiac team, including cardiac nurses, which has had a huge impact throughout my life.
I've got a real interest and love of looking after children and young people that have got cardiac conditions.
I'm a filmmaker, and during my time at BCU, I focused on creating a feature-length experimental documentary film telling my story about my heart condition and my experience in hospital.
Having worked clinically, I then moved into academia and set up a master's, entirely online master's programme in cardiothoracic care. And then that kind of grew my interest in research, and my transition then across to become a researcher and undertaking research over the last 10 years around families' experiences of going home with their baby after cardiac surgery.
Today, I'll be meeting with the UK's first Professor of Congenital Cardiac Nursing, Kerry Gaskin at BCU. We'll be discussing my experiences living with a congenital heart defect and the important role that cardiac nursing plays for someone like me.
It's really nice, I think, for us seeing that other side of it.
Yeah.
Do you know what I mean? Because often you nurse the child and the parents, and then but you only see them when they're in hospital. You don't know what's happening in life.
I guess like the main kind of thing that people associate with the operation is the operation itself, but from my perspective and like a patient's perspective, you know, your experience is based more around the pre-operation and then the post-operation, and kind of the thoughts you might have, the anxieties, anticipations, frustrations, all of the kind of build up, and then the fallout and the recovery. So yeah, I don't know, I have lots of kind of strange kind of memories and associations with it, and yeah, they all come sort of from my state of mind. And obviously when I was younger, you know, it's hard to think back to exactly how I processed some of that, but I think, you know, it definitely kind of it has an effect for sure on the way that you're treated and the way that you kind of experience it. You know, even that affects how, you know, you perceive it later on in your life when if you have to have more, you know, operations.
So I would say, and I think this kind of comes from my research, is that the way that different families deal with trauma is very much based on their educational background, probably ethnic background, family, you know, that the society that you're in. So obviously right at the very beginning, when the parents find out that the baby's got a defect, whether that's before the baby's born, antenatally at the 20-week scan, and the cardiologist, fetal cardiologist is explaining it to them, specialist nurse team will be there explaining to the parents. But parents' understanding will depend on their level of education, their language, you know, whether there's any barriers there, probably also to do with, you know, the job that you're in, you know, where you live. As I say, all of those things around you as a person will affect what you understand about your baby's heart condition, but also then about how you then explain that to your child as they're growing up, especially if it's families that don't speak English and don't have a strong educational background. Then you've got to find a way, bringing translators in, of trying to explain all of those things to the family through a translator. But you might also have a translator that finds it difficult to explain it.
From my experience at least, nurses are always, you know, they're like a kind of first point of contact for me or for the patient, which, I don't know, like it's about reassuring you, and just obviously, you know, they're looking after you on like a technical level, but yeah, more emotionally and psychologically reassuring you and explaining things to you in a way that you can understand, and just making you feel comfortable, because it is a scary situation and you have got a lot of doubts and thoughts and questions. But yeah, just being patient and always, you know, making you feel like, you know, you're supported, and that, you know, you're not, I don't know, I always almost felt guilty because I was so like, I don't know, sometimes, you know, especially straight after an operation, condition is so bad, like you feel you're being sick, it's horrible. And I don't know, just having those nurses there who are understanding of it, when, you know, I genuinely felt guilty. I was like, this is horrible. Like I feel bad for making you even look after me because this is awful. But like, yeah, just having them there to, you know, to be supportive and understanding, that's my experience.
I think from a nursing perspective, it's that kind of holistic approach, isn't it? So we always talk as children's nurses about the child and family. It's never just about the child. And, you know, you've got to make sure that you involve the family, whether that's the parents or whatever the family is for that child. But it is about being there to enable questions to be asked. Obviously, like you say, there's the nursing part of it in terms of making sure that you're well, or your condition, you know, that you're not deteriorating, you have any medications when you need to, and, you know, all of those other elements to it. But there is that psychological side, socio-psychological kind of side of it. And, you know, being there for the
100%.
child and for the family. And if you've been working in that environment for a while and you really fully understand what people are going through, you've seen it so many times that you know, you understand why people are behaving the way they're behaving or feeling the way they're feeling. And it's about giving people that opportunity to talk about it, isn't it? And
definitely,
you know,
I think you can develop like a really close relationship with the nurses or nurse that you have. Like it's, I think that's important. That's what makes it a lot easier. Without, you know, without that, I think it would be.
That's the trust side, isn't it? You have to have that trust. The
operations kind of become these like markers of your life at different times. But yeah, it's always like a kind of alienating experience because at the end of the day, it's uncertain, and you don't know what's going to happen at the end of it. There's always a chance that, you know, just before the operation, you always have that thought like, oh, this could be my last moment. And, you know, it's unlikely, but it's hard not to think that. So in my film, Matter of the Heart, which kind of explores like my experiences, mainly pre and post operation, I used like artifacts, which were like documentation and objects and little kind of pieces. And then, you know, I use that to kind of create this wider story of something that is largely psychological. You might read a phrase on a document, and especially when you're younger and you have no idea what it means, but you have these certain associations, or there's loads of technical kind of jargon, and you think, oh, that doesn't sound good, but I don't actually know what it means.
I think that's really interesting, and really interesting how you think about those objects as triggers. So I guess some of them might be a positive trigger, and some of them might actually have a negative kind of trigger to them. Do some of them trigger off an anxiety response almost, in terms of, you know, how you were feeling at the time?
Yeah, I think so, especially a lot of the like letters and documentation and documents and stuff, because I think that's often how you find something out that's like new information, or you know, you get like a date for a certain procedure. Some of the more personal stuff, like cards that I had in hospital, or like the certificates that nurses gave me and things like that. I find that really emotional.
In the time that I've been a children's cardiac nurse, things have changed so dramatically. So in the last 30, 40 years, there's been such a massive advances in surgery, surgical technique, technology, nursing care, medical care, interventional cardiology. You know, there's been these massive strides, and so now what we're finding is that there are more adults surviving, you know, with congenital heart disease that wouldn't have survived before all of those kind of surgical approaches you know, came into play. From a cardiac nursing perspective, those that are coming into it now haven't seen those massive changes. And those changes will carry on happening. You know, there's always going to be advances, and I think probably technology is the way that we're really advancing now, and imaging, the way that they can image a heart, and that they can create a 3D model of a heart. So, you know, the surgeons can actually see that heart in 3D before they even do the operation. And there are so many advances nowadays that, and it, you know, it will carry on, won't it? Where it's going to go, who knows? As nurses, whether you're a cardiac nurse or a neuro nurse, whatever, all nurses, we're all bound by a code of conduct. And part of that code of conduct is that you practice using the best evidence. And that means that you have to know what that evidence is in your field of work. So research, although not all nurses will be undertaking research or involved in research, you've got to understand how to read research papers and then how to interpret the results of those research papers for your own practice. I suppose my role is very much about, as a professor, it's leading research and undertaking research, but it's also about teaching junior nurses that are in their degree programme. They're not yet registered, but we're teaching them about research and the importance of research and the importance of evidence and how to read and critique it.
I think it's just sort of reassuring to hear that so much thought and time and research goes into it, because like obviously from my perspective, you never see that, but you obviously feel the impact of it. It's good that things are progressing and always evolving. I think, even in like my life, I have felt changes and things kind of improving and shifting, and new methods of surgery and things like that. And like, it's like, it is very reassuring, and I don't know, it makes you wonder, I guess, how things will be in the future. And it can only get better. So that's like really positive.